Some of what you were taught about blood pressure may be too simple for real life after 65. For years, many people heard one message over and over: 120/80 is the ideal number, and lower is always better. That idea sounds clean and reassuring, but older adults are not the same as middle aged adults, and the body changes in ways that make lower at all costs a risky strategy for some people. Today, I want to give you a calmer, more complete way to think about blood pressure after 65. Not fear, not extremes, just clarity. And I'm going to do it in a way that helps you speak confidently with your healthcare provider using observations that matter in real life: how you feel, how you move, how steady you are, and what happens to your pressure when you change positions. Before we talk about any target range, you need to understand one key principle. For many older adults, the most dangerous problem is not a slightly higher resting number. The most dangerous problem is a pressure that drops too much when you stand up. That one issue can quietly reduce stability, confidence, and mobility. It can create that moment where you stand, your head feels light, your balance feels off, and you reach for the wall or the chair because you don't feel steady for a few seconds. Many people brush that off. They call it just aging. They try to ignore it. They stand more slowly. They avoid moving too fast. And slowly, life gets smaller. So if you ever feel lightheaded when you get up from bed, from a chair, or after bending down, keep listening. That signal matters. Let me share a story that will help you understand why. Imagine an older woman in her late 70s. For years, her blood pressure had been moderately elevated. She started with one medication, and her numbers improved. Her provider was pleased, but the plan was to keep pushing the number closer and closer to the textbook ideal, so the dose increased. Then a second medication was added. Eventually, on paper, the readings looked excellent. But a new problem appeared. When she stood up, the room felt like it moved for a moment. Not every time at first, just enough to make her cautious. She mentioned it. She was reassured. Stand slowly, drink enough fluids. It's normal. But her body was telling a different story. Her pressure in a resting position was fine. Yet when she stood up, it dropped sharply. That drop meant her brain wasn't getting the same steady flow for a brief moment. That moment was the problem because it created instability, and that instability changed how she lived. She became careful, then nervous, then hesitant. This is the hidden trap. When a person becomes afraid of those moments, they move less. And when people move less, legs weaken, balance gets worse, and confidence shrinks. Now, I'm not sharing this to scare you. I'm sharing it because it's preventable when people know what to look for and how to talk about it clearly. Here's the big idea. A blood pressure goal that makes sense at 45 may not be the safest goal at 75. Not because older adults don't matter, but because older bodies have different mechanics. There are 4 changes that become more common with age, and these changes explain why older adults often need a different approach. First change: blood vessels become stiffer. When vessels are younger and more flexible, they adjust quickly. When you stand up, the system can respond fast enough to keep blood flow steady, but with stiffness, the system doesn't adapt as smoothly. A number that looks great while you're sitting can behave very differently when you're standing. Second change: the body's pressure sensors often respond more slowly. Your body has built-in sensors that detect changes in pressure and help adjust heart rate and vessel tone. In younger adults, this system reacts quickly. In older adults, it can react more slowly. That delay can be enough to create that brief, unstable feeling when you stand. Third change: older adults can be more sensitive to medications. Many people metabolize medications differently as they age. The same dose can have a stronger effect or last longer, or create more fluctuations. That can lead to pressure that looks fine in one position but drops too much in another. Fourth change: the risk calculation changes. In younger adults, the focus is often long-term protection over decades. In older adults, day-to-day function and stability carry more weight. A plan that increases unsteadiness is not a good plan, even if the resting number looks perfect. So, what does this mean in practical terms? It means we stop treating blood pressure like a single number and start treating it like a pattern. A pattern includes your average resting readings at home, how you feel during the day, whether you ever feel lightheaded when standing, and how your numbers behave when you change position. This is why home readings matter so much. An office reading is just a snapshot. Home readings show your real baseline. And there's another reason home readings matter. Some people are higher in medical settings simply because they're tense, others are the opposite. The only way to see your real pattern is to measure it in your normal environment. Now, before we talk about ranges, I want to separate two numbers because this is where older adults often get confused. The top number, systolic, is the pressure when the heart pumps. The bottom number, diastolic, is the pressure when the heart relaxes. As people get older, it's common for the top number to rise while the bottom number stays similar or even drops. This creates a wider gap between the two. And here's the important point. For older adults, an overly low bottom number can be a problem because it may reduce steady blood flow during the relaxation phase. That can affect comfort, energy, and how steady you feel. So we don't just chase a low top number, we pay attention to both numbers and how you feel. Now, I'm going to tell you something that can change how you approach this. For many older adults, the best blood pressure is not the lowest number you can reach. It's the number that keeps you steady, clear-headed, and stable while still being reasonable over time. That usually means a moderate range, not extreme low, not extreme high. But the exact range depends on your age group and your overall situation. In the next part, I'm going to give you practical ranges that many providers consider reasonable for older adults, and I'll explain how to adjust them based on whether you're active and healthy or whether you have additional conditions that change the risk picture. And most importantly, I'll show you how to do a simple at-home check that can reveal whether your pressure is dropping too much when you stand, even if your resting number looks fine. Now let's get practical. I'm going to share ranges that many clinicians consider reasonable for older adults, but I want you to hold one idea in mind the entire time. These are not rules carved in stone. They are starting points for a conversation with your healthcare provider based on how the aging body works and what matters most for safety and daily function. The reason I'm giving you ranges instead of one perfect number is simple. Older adults are not one category. A healthy, active 68-year-old is not the same as a frailer 84-year-old. And someone with additional conditions has a different risk picture than someone without them. So here are the ranges in a clear, usable way. For many adults between 65 and 75 who are generally healthy and active, a reasonable goal for the top number often falls in the 130 to 140 range, with the bottom number commonly in the 70 to mid-80s range. For many adults between 75 and 85 who are still doing fairly well overall, a reasonable goal for the top number often falls a little higher, commonly around the mid-130s to mid-140s, again with the bottom number commonly in the 70 to mid-80s range. And for adults over 85, or for those who are clearly frail at any age, many providers prioritize stability and independence. In that situation, it's not unusual for the top number to be allowed a bit higher, often around the 140s and sometimes close to 150, as long as the person feels steady, thinks clearly, and is not having frequent symptoms. That's the general framework, but now we need to talk about the group that changes the decision. If you have certain conditions, your provider may lean toward the lower end of those ranges while still avoiding an overly low pattern that causes unsteadiness. This includes people with diabetes, a history of cardiovascular events, or kidney concerns. In those cases, careful control can be important, but careful control is not the same as aggressive control. The approach needs more monitoring, more patience, and a stronger focus on how you feel day to day. This is why two people of the same age can have different targets and both be doing the right thing. Let me give you a simple way to understand that. Imagine two people, both 72. One is active, walking regularly, No major conditions, good energy, good appetite, steady balance. Their resting readings are mildly elevated, but they feel great. The other has diabetes and reduced kidney function, and they've had past cardiovascular concerns. Their risk picture is different, so tighter control may be more beneficial, but only if it doesn't cause unsteadiness. Same age, different context. That's why a one-size-fits-all target can cause trouble in older adults. Now I want to emphasize something important about the bottom number. In older adults, the bottom number becoming too low can be a warning sign. The body may not tolerate a very low bottom number as well because the heart and brain rely on that steady pressure between beats. So, if your bottom number is frequently below the low 60s, especially if you also feel lightheaded or unusually fatigued, that is worth discussing with your provider. It doesn't automatically mean something is wrong, but it's a pattern that deserves attention. Now, let's talk about the most important part of this entire conversation, the position change drop. This is what many older adults never get taught to check, and it's one of the most useful things you can test at home with a basic blood pressure monitor. Here is a simple way to do it. First, lie down and rest quietly for 5 minutes. Not sitting, lying down. Then check your blood pressure and write it down. Next, stand up carefully. As soon as you are standing, check your blood pressure again. If you can, check one more time after about 1 to 2 minutes of standing. Now, what are you looking for? You're looking for a significant drop after standing. A common sign is when the top number drops by more than about 20 points, or the bottom number drops by more than about 10 points compared to your resting reading. If that happens consistently, it may explain why you feel off balance after getting up, even if your sitting number looks good. This pattern is often a sign that your body is not maintaining steady pressure when you change positions, and it may be a sign that your plan needs adjustment, especially if you're taking medications that lower blood pressure. Now I want you to notice something. This test shifts the focus from chasing a perfect sitting number to protecting your stability while you move through real life. That's what matters most. So if you do this test and notice a large drop, the goal isn't panic. The goal is information. This is a useful result to bring to your provider. Because if your provider sees a resting reading that looks great, they might assume everything is fine while you are quietly dealing with moments of unsteadiness at home. This test helps you show the full picture. Now I want to give you an example of how this can change outcomes. A person may have a resting reading that looks quite good, something like the mid 120s over the mid 70s. On paper, it looks ideal. But then when they stand up, the reading may drop sharply. The person feels lightheaded, cautious, and uncertain. In that situation, allowing the resting number to be a bit higher can actually improve safety and comfort because the standing number becomes more stable. That's the key. Sometimes a slightly higher resting number can be safer because it prevents the drop that happens during standing. Now, in the next part, we'll go one step further. I'll give you a simple, clear protocol you can follow for 2 weeks that helps you and your provider decide on a realistic target based on your average readings, your symptoms, and your standing test results. And I'll address common questions that come up, including what to do if you feel your provider is focused only on the number and not on how you feel. Now, let's put everything together into a clear, practical plan you can actually use. This is not about changing anything on your own. It's about understanding your pattern well enough to have a productive, informed conversation with your healthcare provider. Think of this as a short evaluation period, not a permanent decision. Here's a simple 2-week approach many people find helpful. Step 1 is home monitoring. Check your blood pressure twice a day, once in the morning and once in the evening, around the same times each day. Sit quietly for a few minutes before measuring. Write the numbers down. Do not worry about individual readings. What matters is the overall average across many days. Step 2 is the position change check. On at least 3 different days during those 2 weeks, do the lying to standing test. Write down what happens to your numbers when you stand. Also, write down how you feel. Do you feel steady or do you feel off balance for a few seconds? Step 3 is symptom awareness. Pay attention to your body. Notice whether you feel lightheaded, unusually fatigued, foggy, or hesitant when moving. Also notice whether you feel stable, confident, and clear-headed. These observations matter just as much as the numbers. Step 4 is context. Make a short note of your age range and whether you have conditions like diabetes, heart concerns, or kidney issues. These don't determine one exact number, but they influence where the safer range might be for you. After 2 weeks, you now have something powerful, a real-world picture of how your blood pressure behaves in daily life. This is very different from a single office reading. Now let's talk about how to use this information in a conversation. If your average resting numbers are slightly higher than the traditional ideal, but you feel steady and your standing numbers remain stable, that may be a sign that your current range is appropriate for you. If your resting numbers look perfect on paper, but you feel unsteady and your pressure drops significantly when standing, that may be a sign that your current plan is too aggressive for your body. Neither of these situations means something is wrong. They simply mean your body is giving you information. This is where many older adults feel dismissed, and I want to help you avoid that. Instead of saying, I don't like my medication or I read something online, you can say something much more effective. You can say, I've been tracking my blood pressure at home, and I've noticed that when I stand up, my numbers drop significantly and I feel unsteady. I'd like to review my targets and see if a slightly different range might be safer for me. That statement is clear, respectful, and based on observation. Most providers respond very differently when they see data and hear about function, not just preferences. Now, let me address a few common concerns that come up at this stage. One common question is, what if my numbers vary a lot from day to day? That's normal. Blood pressure naturally fluctuates with activity, stress, sleep, and meals. That's why averages matter more than single readings. Look for patterns, not perfection. Another question is, what if my provider insists on one exact number for everyone? Some providers were trained under older guidelines and may be cautious about change. In that situation, asking for explanation can help. Ask how age, balance, and standing readings factor into the recommendation. Sometimes this opens the door to a more individualized discussion. If you ever feel that your concerns about steadiness or daily function are being dismissed, it is reasonable to seek a second opinion. That's not confrontation, that's self-advocacy. Now let's talk briefly about cognition and energy, because this is another area older adults often notice changes. The brain sits at the top of the body and relies on steady blood flow. If pressure is too low, especially during position changes, some people notice difficulty concentrating, slower thinking, or unusual fatigue. These changes are often subtle. People may blame age, stress, or poor sleep, but for some, pressure that is too low for their physiology can play a role. The goal is not high pressure. The goal is enough pressure to support comfort, clarity, and stability. This is why extremes at either end can be problematic. Very high pressure over many years can be harmful. Very low pressure in later life can also be harmful. The middle ground is often where older adults feel and function best. Now I want to leave you with a clear summary you can remember. For many older adults, especially after 75, safety and stability matter more than achieving a textbook number. A moderate range that supports balance and daily function is often safer than pushing numbers as low as possible. How your pressure behaves when you stand up can be more important than how it looks when you're sitting quietly. Your symptoms, energy, and confidence while moving are valid signals. And your target should be individualized, not automatic. You are not failing if your number is not perfect. You are doing well if you are steady, clear-headed, and able to live your life with confidence. In the next and final part, I'll bring everything together into a simple reference summary you can return to, and I'll explain how to revisit your target over time as your body changes. Let's bring everything together in a clear, calm summary you can return to whenever you need it. If there is one idea to remember from this video, it's this. After a certain age, blood pressure management is not about chasing the lowest possible number. It's about finding the range that keeps you steady, clear-minded, and able to live your life with confidence. For many older adults, especially after 75, a slightly higher resting number can actually be safer than a very low one. Not because high pressure is good, but because pressure that is too low for your body can reduce stability when you stand, affect balance, and make everyday movement feel uncertain. This is why the way your pressure behaves during position changes matters so much. A number that looks fine while sitting can behave very differently when you stand up. If your pressure drops sharply when you change position, that drop can explain dizziness, unsteadiness, hesitation, and fear of movement. Over time, those small moments add up and can quietly shrink your independence. That's why checking how your body responds to standing is one of the most useful things you can do at home. It shows your real life pattern, not just a snapshot. Now let's review the practical takeaways. For many adults between 65 and 75 who are healthy and active, a moderate range often provides a good balance between protection and comfort. For many adults between 75 and 85, allowing the top number to be a bit higher often supports better stability and reduces the risk of feeling unsteady. For adults over 85 or for those who are clearly frail, preventing instability and preserving daily function often becomes the top priority. In that situation, avoiding overly low pressure can be just as important as avoiding very high pressure. If you have additional conditions such as diabetes, heart concerns, or kidney issues, targets often need to be adjusted more carefully. The goal is not extremes, but a range you tolerate well without symptoms. Across all ages, one warning sign deserves special attention: feeling lightheaded, dizzy, or off balance when standing up. That signal matters, is not something to ignore or simply attribute to age. Another important reminder is about trends, not single readings. Blood pressure naturally goes up and down throughout the day. One high number or one low number doesn't define your situation. What matters is the average over time and how you feel during daily activities. This is why home monitoring combined with symptom awareness gives you the clearest picture. Now let's talk about how often to revisit your target. Your ideal range is not fixed forever. As your body changes, what works well at one age may need adjustment later. It's reasonable to reassess every 6 to 12 months or sooner if new symptoms appear. This is not a failure, it's normal aging physiology. The most effective approach is ongoing observation, open communication, and gradual adjustments when needed. If you ever feel that your care is focused only on numbers and not on how you function, it's appropriate to speak up. You are not being difficult by asking how balance, energy, and clarity factor into decisions. You are being responsible. A useful phrase many people find helpful is, "I want to make sure my blood pressure plan supports my balance and daily function, not just the number." That simple statement reframes the conversation in a productive way. Before we finish, I want to reassure you of something important. You are not doing something wrong if your blood pressure is not at a textbook target. You are not failing if your provider adjusts your goal over time. And you are not giving up by prioritizing stability and quality of life. Good care after 65 looks different than good care at 45, and that's okay. The goal is not perfection on paper. The goal is confidence when you stand, clarity in your thinking, and the ability to move through your day without fear. If this video helped you understand your blood pressure in a new way, consider saving it so you can revisit these ideas later. And if you know someone over 65 who feels unsteady or confused about their numbers, sharing this information may help them ask better questions and feel more confident. Thank you for spending this time with me. And in the next video, we'll continue focusing on practical, calm guidance that supports well-being and independence as you get older.